physical therapy was my start, and I got interested in that actually as a high school and college athlete, being injured and interacting with my athletic trainers and seeing how they could diagnose and treat me with nothing more than their hands and critical thinking. And that was very appealing to me, to not to have an avenue of healthcare that wasn't reliant on imaging or complex procedures or lab work, to be one-on-one interacting with people. The majority of my career has been hospital based therapy. So I started out in acute care, treating patients at the bedside during their hospitalization for 4 years. And then I switched to outpatient hospital based physical therapy, doing mainly neurorehabilitation and geriatric balance and fall prevention. My staff development specialist role is at that same hospital, which is a lot of clinical education for the rehabilitation department, as well as collaborating with the nurse educators to bring about some quality improvement projects. The health coaching came about as my pandemic project. So I I think with a lot of us having some more space to think or triggers to think about where we want our career to go, I was really looking for a way to help people transform their health and really change it for good and not have this cycle of illness and relative recovery, but to actually encourage people to find ways to transform their own health so things didn't keep coming back as problems.
Yeah, it's interesting. This is a theme that I've heard before. It's the difference between not being sick and being well, and it
Mhm.
sounds to me like that's kind of what you're looking at. Am I properly understanding that?
It is, yes. And it's something I think I've been chasing for a long time. It was part of my impetus to switch from acute care physical therapy to outpatient, where I thought I could work with patients for longer, help them become stronger and better and not need me anymore. But some of my patients would come back every 6 months. The gains they'd made in therapy weren't lasting, they weren't carrying out the home program that we had established. And also, I was realizing a lot of them needed help with nutrition or sleep or stress management, things we could hint at during physical therapy but couldn't address fully.
Yeah, and again, what you're talking about is a theme that I've heard before, and that is the holistic approach in which as a you're looking at them, and it's more than just strengthening, it's more than just balance and fall prevention. It is a holistic approach of your sleep patterns, your nutrition, all of those things together that create your life and create your I don't know if this is a proper word or not, but your health portfolio, right? It's
Mm-hmm.
it's all of it wrapped up together into who you are and how you live and your your wellness, so to speak. So, okay, what does quality healthcare mean to you?
I've been thinking about this question a lot, and I think for me, quality is health actually has to improve with the care, just getting to the basics of is it working? And then, like we were just talking about, does that improvement last? So, not only does it work in the short term, but do we have long-term health benefits from the intervention as well?
Okay, uh, when you when you find patients for whom the treatment doesn't last, were you able to kind of diagnose what is it about the treatment plan that was not working for them, and where how did they fall off the wagon, or how did they like where were they falling between the cracks? Do you understand what I'm asking, I
Mm-hmm.
guess?
Yeah, I think there are a few different ways to approach it. So some is is the treatment plan actually the right one for the patient? So we have a lot of, as the research improves, we have a lot of general recommendations for patients, but it doesn't mean for that individual patient that it's the right recommendations. I think there's some critical thinking piece on the clinician's part of, does this actually apply to the person in front of me? Um, what I see often in patients who may have more chronic conditions, so they might, in the case of someone with a balance issue, they may have multiple chronic conditions. Nothing's really changing with them, but it's hard for them to maintain the program. And what I've found is, in that case, the less I can dictate the home program and the more I can get the patient to come up with it themselves with my guidance, the better it goes. So there's someone I'm working with now who was evaluated by a different therapist, given a home program. She's not doing it. I asked her why. She said she's lazy and forgot. And I'm like, there's got to be more to it than that. That was a couple weeks of that. And so now I asked her to come up with her own program to help her meet her goals. And she immediately came up with, well, I can walk up and down the stairs in my apartment building every day. And there's a neighbor that I want to go on walks with. And I said, great, that will help you get stronger, and that will sustain more than doing some exercises with the TheraBand. Um, so I think the collaboration is key in really honing in on what are the barriers and what will get you to actually do it without me around.
Yeah, it's amazing when you empower the patient to be part of the team, be part of the process. It makes a huge difference in their adherence to the plan, because they've got some ownership in it, and because they understand their lifestyle a whole lot better than any of the professionals do. So, and I think in some ways you just answered this question, but it's on my list, so I'll ask anyway. Can you give me an example of quality healthcare?
Sure, I can give you another more broad example if that works. So,
That's great.
um, something I've been experiencing lately is evolutions in stroke care. So, the hospital where I work is in the process of becoming a comprehensive stroke center of excellence. And it starts really with the EMS service. So, the amount of coordination between EMS, the emergency department, radiology, pharmacy to help patients with an acute stroke get intervention as quickly as possible is just, I almost get emotional with the amount of collaboration and cooperation to get things done in a timely manner. And what can happen is, if they have an ischemic stroke, the clot form and can get the clot busting medication as quickly as possible, then their long-term disability is reduced greatly. So from the hospital side, I think that's an enormous quality improvement project. And it's trickling down now on outpatient, where the patients I'm seeing with stroke now are often walking into therapy, whereas before they were coming in wheelchairs. And the whole trajectory of their lives has changed because of this coordinated effort on the front end. So I think from a hospital perspective, that's a great example of quality, timely intervention that has a long-term impact. And then where my role comes in more on the back end is continuing the collaboration, the partnership, and the support throughout the rest of the person's life through some community groups to help them sustain the gains that they've made and continue to improve.
Yeah, and that the concept of collaboration from the very beginning is so powerful. Sometimes it feels like wherever you come into the system, there is a lapse before the collaboration can start. So if you come into the emergency department, then they see you, and it doesn't. The whole thing doesn't start. The collaboration process, I mean, it doesn't start until things have kind of gotten rolling a little bit, and you're in the system, and then it starts from there. But you're talking about almost immediate collaboration from the very initial call when you've got EMS there. What a Yeah, the whole thing works where you've got pharmacy and everybody involved. A very different style of collaboration and a
Mm-hmm.
different timeline. So yeah,